All right, we're going to go ahead and get started. Hello and welcome to Spectrum Health Media Briefing. I'm Carrie Manders from Spectrum Health Marketing and Communications. Thank you for joining us today. Our objectives for today's briefing is to give you an update on COVID-19 as well as vaccination progress as we roll into the next phase of eligibility. We will start this briefing with some opening remarks from Tina Fries-Decker, Spectrum Health President and CEO, as well as Dr. Daryl L. Mucci, President of Spectrum Health West Michigan. And then we will open it up to your questions. So please place your questions in the chat and we will call on you live when it is your turn to ask your questions. We will of course try to get to all the questions, but we will get to them as time allows this afternoon. With that being said, I'd like to turn it over to Tina to get us started this afternoon.
Thank you, Carrie. Today is an exciting day. This morning, we began vaccinations for people who are in phase 1B. There has been a great deal of progress since the MDHHS announcement last week to expand vaccinations. And I am incredibly proud of our team for their agility and their ability to scale up this vaccine distribution. And we are also very thankful for the great collaboration among other health systems and health departments to operationalize some of these solutions in a very short order. This collaboration is called the West Michigan Collaborative, and it's across 16 county region consisting of health systems, health departments, and many others. And our focus is on coordination of the vaccine distribution, sharing information and best practices, and making sure that no one is left behind as we move through these phases to get shots in arms for our community. This past weekend, we reached out to our database of 700,000 patients to engage them in the process of registering for the vaccine based on their eligibility. And by the end of this week alone, we will have vaccinated approximately 10,000 people. It's important to know that we're only scheduling appointments for the supply that we have on hand. And we're also still continuing with those within 1A category. We know it's not going to be perfect, and we continue to work through our processes to make it even better every single day. And Dr. Daryl Mucci will provide more details about our vaccine distribution process in a few minutes. We continue to learn lessons regarding COVID-19 as well as the distribution of the vaccine. And we pivoted from some of the early planning as we found better solutions in the first few days to be more efficient. But I also want to make sure that we highlight some of the positives because there is so much to be proud of. We have a vaccine in less than 12 months. Since we began this vaccine distribution with 2 holidays and over 20 days, we provided nearly 20,000 vaccines to healthcare workers and first responders. I'm so pleased that 75% of our team members want the vaccine, which is fantastic. And we've started to give second doses. And so overall, I feel really pleased with the progress that we're making and very excited to begin vaccinating our community members. Before Daryl speaks, I thought I'd just give you a brief update about where we are with COVID-19. We are in a much different position than we were last November. We're seeing the December plateau and also reduced hospitalizations. This morning, we had about 183 COVID-19 patients in one of our West Michigan or Lakeland facilities. And we're still high in ICU, but only about 20% of the ICU patients are COVID. We also pay a lot of attention to that positivity rate, that rolling 7-day average. And over the weekend, we saw that it's about 11.4% for that 7-day average. So it's been plateaued, and we're hoping that it continues to decrease. But for right now, we're optimistic that there won't be any post-holiday surges. What we are looking at is this new strain, the COVID variant. It is a bit worrisome. It's not more fatal, but it is more contagious. And when it's more contagious, then people could catch it more and then come in the hospital. And so we are really watching that to see what's going on. The only way to detect it, though, is to do a detailed genetic analysis of the virus through the state or the CDC lab. And so we know that they're looking at it. Surveillance is in progress. It's just a matter of time to know if it's going to spread. And so that's our update for COVID-19. And now I'd like to have Dr. Daryl Mucci give us an update about the vaccine and the vaccine distribution process. Daryl?
Thanks, Tina. So as Tina mentioned, today really was a milestone day for us and for West Michigan. At 6 a.m. this morning, we opened up our first high throughput or large clinic to be able to vaccinate as many community members as possible. We did this following the government's guidance within the state of Michigan. So this now includes most of 1B and part of the 1C phase that you've all read about, essentially those 65 and older in the community, as well as specific frontline workers like teachers, childcare workers, law enforcement, prison staff. We have really worked a lot over the last few days and even few weeks, but specifically the last few days when this announcement came up to scale up this clinic. And we're really focusing on trying to be as broad as possible and having as many of our community members vaccinated as possible. I will give you some statistics. As of noon today, we had vaccinated 575 people through our clinic, which is on 60th Street in Grand Rapids. We have created 11,000 appointments. Of those, 6,400 are 75 and older. We've scheduled 3,600 teachers and school staff, over 200 law enforcement, and still have a few remaining 1A folks, about 500 across the community that we have scheduled to vaccinate this week. And as Tina mentioned, and very importantly, we are not making appointments when we know we won't have vaccine. We're only scheduling appointments for the vaccine we currently have on hand. Our goal for these high throughput clinic is ultimately to be able to vaccinate thousands per day at the one site alone. We also are standing up clinics across our regional hospitals over the course of this week and next week. We're also working very closely with all local health departments and other health systems on mobile clinics. These are very specific where we can target populations that are underserved and that may not have access to the electronic means. We're scheduling appointments now. We hope to open our first, hopefully next Monday on Martin Luther King Day. So there has been an immense effort. And ultimately, our goal, which I'm sure all of you share, is to vaccinate as many people as possible. The only limitation over the coming weeks will be vaccine allotment to the state and ultimately to us, and we're sure hopeful that that will continue to expand. And with that, I'm happy to turn it back to Carrie for questions.
Thank you, Tina and Daryl. We'll get right to the questions. Some of these you may have already answered, but we will let the reporters go ahead and answer questions. So let's first go to Karen Bouffard with Detroit News.
Hello, thanks for taking my question. So I wanted to ask how many doses of vaccine you currently have available and how many people are in the population that is now eligible to be vaccinated in your region?
Sure, and I can take that. So as far as doses available, we have approximately 20,000 doses on hand. As I mentioned, 11,000 community members scheduled, and still a pretty large number of healthcare workers in that 1A category that are scheduled for their second dose. As far as who we think the absolute number in the 16 counties we serve, we're estimating somewhere between 300,000 and 400,000 people will meet this criteria, the vast majority obviously being the 65 and older population, but between that and the other groups. So a very large number of people that we're hoping to vaccinate over the course of the coming weeks and months.
Let's go to Aaron Winder with Grand Rapids Business Journal.
Hello, thank you. You answered the first part of my question, but I was curious to understand if you have any measures in place to prevent vaccine waste if they are past their expiration by any chance.
Absolutely, 100,000%. Vaccines are like gold. We don't want any to go to waste. And so a couple things I'd comment. Number one is, remember, as long as you follow the cold storage recommendations, vaccines can last up to 6 months in the freezers, which is good. We have no intention of keeping any vaccine, hopefully more than a few days once we really have these clinics up and running. And then as long as we keep our slots filled, which we're doing everything we can given all the demand, we will be able to use all the vaccine. Even once you thaw it and dilute it, you still have a number of hours. So we have no concerns about spoilage or waste.
Thank you.
All right, let's go to Heather Walker with Wood TV8.
Hi there. Thanks so much for doing this. We are continuing to get questions and concerns from people that are in that 65 and older group. They've been trying to make appointments and they're unable to do so. What is your advice to them? How can they make an appointment?
Yeah, so we've tried to make this as easy as possible, knowing that we had to stand this up very quickly. And so on our website, the spectrumhealth.org website, there's a tile or banner at the top that brings you to a vaccine page that has very detailed step-by-step instructions how to do this electronically, either on a computer, a cell phone, an iPad, where you can either use your existing Spectrum Health My Chart account or very quickly sign up for a new one. And then within the app is how we do this. People can actually click on a survey where it says their age, their occupation from a drop down, so we'll know if you're one of these prioritized groups. And then as we have more vaccine and more clinic appointments available, we will send electronic notifications saying you're now free to schedule. You've been essentially put in the queue, and then people can schedule, and all of the appointments that I mentioned, this 11,000 appointments, almost all of those were done via that mechanism very smoothly. And I just ask people to have patience because the demand is obviously incredibly high and we're doing our best, but not everyone will get a vaccine this week, clearly.
And are there appointments available today? If I want to go on right now and schedule an appointment, can I do so?
No, actually we have over 1,800 appointments already scheduled for today, which maxes out that clinic. Our goal is to try to expand and ramp that up, but right now we have appointments. I don't know if there are any open through the end of the week now because of how much demand there's been. And given the amount of vaccine we have, we're not opening appointments for next week until we're ensured we get more vaccine from the government.
And when will you know that? Do you have a time frame on when you'll hear yes or no?
We hope any day now. Right now we know we're going to get 3,000 more Pfizer doses. We don't know yet about Moderna, and we legitimately would love as much vaccine as we can have, and we will put those in arms as quickly as we can.
So it's not that there's a lack of people to put them in the arms, it's that there's a lack of doses to give out.
At this point, yes, because we've scaled up so quickly.
Okay, thank you.
Sure.
Thank you, Heather. Let's go to Dustin Dwyer with Michigan Radio.
Hello, this is sort of related, but if a person is a Spectrum, how do they know whether to sign up through Spectrum or through their local health department? Is that all integrated on the back end, or are people trying on multiple platforms here?
All right, Tina, I'll take this one if you don't mind too. And so ultimately, I would say this, I think it's reasonable for anyone to try to look at their local resources to determine what the best mechanism is for them. Depending on the county you live, you can go to the county's website to see if you can sign up. If there's availability, great. You're always welcome to come to our website and try to go through us. There unfortunately is no way that our systems can electronically talk to one another. And I can tell you, at least for the counties that we're working very closely with, that everybody has the same limitation in terms of vaccine availability, and that our size and the number of counties we cover gives us potentially more vaccine, and we obviously have more staff, so we're hoping we can supplement whatever the local health departments aren't able to accomplish.
One other clarifying point is that you do not need to be a Spectrum Health existing patient to sign up for this. You can create your own My Health account on our website and then take the questionnaire that Daryl said. And so you do not need to be an existing patient to participate in this.
Thanks, Tina.
Could I ask just a follow-up on that? With regards to testing, people were scheduling multiple appointments when those were in short supply, and they would go to one place and try there and fail and then try somewhere else. Are you concerned at all that that's going to be replayed with vaccination scheduling, and what kind of havoc might that create?
Yeah, that's a great question. I can tell you that once we give you an appointment, it is locked. It is a contract between you and us. We're not going to schedule appointments without having vaccine. So I'm hopeful that won't happen. If that does happen, the risk we run is we'll have slots that go unused. We can end up using that vaccine, I assure you, for the remaining patients. But the more people that miss appointments, the longer it takes to get through the rest of the population. So I'm hopeful, but we have no mechanism to prevent it.
All right, we will go on to, and I apologize, I don't know your first name, Jay Mack, who's got a question about the essential workers.
Hi, it's Julie Mack from MLive. So here's my question. If you're an essential worker, should you be waiting to hear from your employer? Are you scheduling vaccination clinics for like the whole school district, or should the teachers be reaching out individually to make an appointment? How is that going to work for the essential worker group?
Yeah, no, that's a great question. So I can tell you that we've been in contact with nearly all of the local health departments that where we serve, because the way this was supposed to roll out from the state is that the health departments would then allocate how these individual essential workers get vaccinated. I can give you an example in Kent County, which I think is a great example, that we've worked with Adam London, the director of the health department here, along with the other local health systems. And for school districts, for instance, we are all assigned from the health department school districts that we should help vaccinate. And so we, Spectrum Health, have sent a notification to superintendents of the school districts we were assigned to ask their staff to sign up on our site to get vaccinated. We are not limiting it to others that might sign up, but we're preferentially focusing. That way the other health systems can focus on those other school districts, and we can try to get this all done as quickly as possible.
And I have another question too. And that is that, so on one hand, you say the limiting aspect is the number of vaccines available. And yet right now there's this huge gap between vaccines that have been distributed in Michigan and the number actually administered. So so that seems like somewhat of a.
So I'll take this, and if Tina wants to add to it, by all means. If you recall, up until this morning, we were in the 1A category, and quite honestly, across the state, talking to everyone, and this really happened in many places across the country, it was very hard to prioritize and categorize within that 1A category, specifically when we all first focused on emergency department staff, ICU staff, COVID unit staff. And so there were days where we would try to get all of the ICU staff, but we had to stagger those. We'd have open slots and we'd have unused vaccine. Now that we've opened it up in such a larger way to the population, as we talked about with 300,000 plus community members that are eligible, the demand is so high that we all feel we could give out as much vaccine as we can with the limitation of being vaccine and obviously depending on resources at different sites, staffing, but we really are rallying all of our troops to try to do this as quickly as we can. And I think you'll see across the state things open up and the vaccine being used much, much more rapidly than it was in the first round.
One of the lessons that we've learned is that this really needs to be, at least to begin with, a really large scale process. You know, we're looking at two approaches: this large scale process that we put in place today where we can vaccinate, you know, hundreds of people, thousands of people, and then we'll have these mobile clinics where we can go in a targeted approach. But we believe this way we can get more vaccine, more shots in arms. And so what we will see in the coming weeks is that the issue won't be people, won't be staffing or the ability to provide this, it'll be the vaccine availability.
All right, great. Let's move on to Ken DeLotte for your question.
Hi, Ken DeLotte from Near North Now. Wondering when will, you mentioned the regional hospitals will be getting the vaccine and also be putting on clinics. When will that happen?
We have plans to open up Zealand's clinic and Pennock's clinic on Wednesday, and we'll be scaling those over the course of this week and early into next week to open as well. I believe Lakeland is opening their clinic later today. And so across all of our region, our hope would be by the end of the week that we have clinics pretty much everywhere. And then as Tina mentioned, we'd start opening these mobile clinics as early as next week.
Thank you.
All right, let's go to Callie Rainey from News Channel 3.
Hi there. Just a couple of questions here. Do you all have anything in place to safeguard and ensure people aren't cutting the line or maybe crossing borders or anything like that to get the vaccine?
So one of the things that we have on our website is that you take this questionnaire, and on that questionnaire, it asks you several questions about your age, where you may be working, and so we can then use that information to determine eligibility based on the phases that we're in right now and then future phases that are coming forward. So we're looking at that information. It is populated by the person, using that to then send out a notice that they can be scheduled for their vaccine. We also have an ethics committee that gives us guidance on how do we approach this and making sure that we are providing the vaccine to those that are most vulnerable and consistent with the rules of the 1B and some of the essential workers identified.
Awesome. And then I have just a follow-up, going on to that ethics committee. That's great that you will have that. Does that also, whenever you were talking about vulnerable, does that mean, say, someone who technically falls in phase 1A, but maybe it's like a therapist who is not leaving their house, they're not at risk, would they get moved farther down if someone else needed that same appointment opportunity who maybe is more at risk and more vulnerable?
So I'll take that. Ultimately, we're relying on the good graces of individuals who are filling out the survey. And we have had, a matter of fact, someone I know mentioned to me, hey, I'm going to defer and wait until more people get their vaccine. But we, unfortunately, given the method and the large scale that we're doing this, wouldn't have a way to know upfront that that person is working primarily in their home and someone else is out in the community without them letting us know that.
All
Great,
right,
thank you.
let's go to Mark Sanchez with MIBiz. Mark, your question might have already been answered, but I'll give you the opportunity to ask another question.
You're muted, Mark. Mark, you're on mute. You always have to have at least one at every meeting, right?
And maybe he's having connectivity issues. I think we've already answered his question. He asked if we were going to set up other clinic locations beyond what we have, and how many doses do we presently expect to receive. I don't know if we answered that.
The only comment I can make on the doses received, and obviously this might change as we're hearing the federal government might be changing some of their criteria. We're still under the assumption that we'll receive second doses to match our first doses, and that's how we've scheduled our healthcare worker clinics. Beyond that, we don't know yet, and we are very hopeful that that ramp up will keep continuing to meet our goal of vaccinating everyone in West Michigan.
Okay, Mark, and if you have any other question, put it in the chat. I'll keep an eye on it.
Mark.
All right, David Bosick, I'll go over to you.
Thanks, Dave Bosick from the Ludington Daily News. What was the criteria to determine where the vaccination clinics were opening up this week, and what criteria is needed to open up vaccination clinics beyond the 5 locations that were announced today in the press release? And then beyond that, when could the public expect more information on the mobile clinics that you guys have described?
Yeah, I'll take that one as well. So to be very honest, we looked at our first goal was how can we open a clinic as quickly as we can, as safely as we can, to administer as many doses as we can. And that's what came up with our first clinic that's in the Grand Rapids area, because we know we can ultimately scale this to do, we believe, about 2,500 doses per day in that clinic. And our goal would be to try to have clinics like that that can do huge volumes, and then geographic dispersion to make sure that we're not making people drive 60 miles to get a vaccine. So from our regionals, we're looking at sites that we think we can safely deliver this. As far as the mobile clinics, again, those are really going to be targeted in underserved areas where we have people that might not have any transportation. So we are working with all our local health departments to determine the best location, and we hope to start advertising at least one or more of them, maybe by the end of the week or early next week as we ramp up and open this. And I just want to mention to everyone, please have patience with us. We are absolutely trying to do the best we can, and this is literally moving in 1,000 speed, trying to get it done. So everything isn't perfect, but we're hoping it's pretty darn good and we'll get the job done.
All right, let's go back to Karen. I think you had a clarifying question from Detroit News.
Yes, hi. So you had made the remark, quite a while ago that there were going to be 18 vaccinations today. Did you mean they were scheduled today, or are you able to do 18 vaccinations today? How many?
At our primary new high throughput site that we opened today, we opened at 6 a.m. for the phase 1B. We have 1,800 people scheduled for vaccination today at that site. And that's the site that I hope we can scale up to 2,400 to 2,500 per day as early as tomorrow or the next day. And so we have that all scheduled. We've already done, at least a third of those people, and we hope to get them all done today.
I'd like to stress that it's really important that this is scheduled appointments. We have seen a few people show up and stand in line, and it's all scheduled. We have it coordinated in that way. So it's really important that it's known that we need to schedule the appointment.
All right, we've got time for about 2 more questions. So I'm going to go to Brian McVicker first, and then we'll end with you, Mark Sanchez. So Brian.
Good afternoon. I was just wondering if you folks can talk a little bit about demand for the vaccinations that have opened up today, or vaccination appointments for adults 65 and older and those in 1B. You know, how quickly did those fill up, and you know, how many people maybe tried to get one scheduled but were unfortunately turned away?
Yeah, so this is tough, and this is the hard part. So demand is truly astronomical, as you could imagine. We had over 45,000 surveys completed from Saturday morning until the end of day yesterday, so in about 36 hours. That is now expanding exponentially. And as you can imagine, the only way to do this process in a very rapid, large-scale way is to try to make it as digital as we can, which is what we've done. And obviously, there are some people that just struggle with technology, don't have access. So I'm just getting notifications, you know, our call centers are being called with questions that we just don't have the capacity even to answer in a timely fashion because of the demand. So there is a lot of pent-up demand out there. We're doing our best to try to help everyone, knowing that, you know, we don't have the capacity to meet all that demand, particularly from the call center.
All right, and then let's
Just real quick, the vaccination center in Grand Rapids that's taking appointments today, that's on 60th Street, you guys said?
Mm-hmm.
What's the address?
Carrie, can you provide that? I don't actually have the address.
Yeah, we'll follow up with you
Thank
on
you.
that, Brian.
Sure.
But I do want to make sure that, again, we don't want long lines of people there hoping to get the vaccine. It does need to be scheduled.
All right, let's go to Mark Sanchez. Hopefully we can hear you. Otherwise, we'll just take the question from the chat. All right, so I'll read it. What are we doing? I think you already addressed this a bit, Tina and Daryl, but just maybe a good closing question is, you know, what are we doing to reach minority communities to encourage people to get vaccinated? As we know, surveys show that our Black community and Hispanic community are less likely to get the vaccine.
As Daryl mentioned, we have the mobile clinics that we are working on, but we also are engaging with leaders in many of the communities to talk about the benefits and the reason to get the vaccine. It's really some of those one-on-one conversations with a trusted relationship that's critically important. And so we've been engaged with leaders throughout COVID-19, and now as we do the vaccine, to help make sure that we can connect to those communities.
Thank you, Tina. Well, why don't we turn it over to you for some closing remarks?
I just want to say thank you for joining us for this update on COVID-19 and on the vaccine distribution. As you can tell, we are very thrilled that we can now offer this to especially those over age 65 and to other essential workers. We've had an overwhelming response to expanding our COVID-19 vaccinations, and we look forward to vaccinating as many people as possible. Our goal is just that, to get shots in arms. And so like we said before, you can prepare for scheduling your vaccine by following the steps on our website. You can also go to vaccinatewestmichigan.com, which is this West Michigan collaborative with the health departments and health systems. We're really trying to coordinate this process and have as minimal confusion as possible. We will be posting frequent updates at our website, spectrumhealth.org/vaccine. And we appreciate your interest in this, and also know that we're trying our very best to get this out to our community. And please continue to encourage people to get that vaccine, get the facts so that people can make informed decisions when it's their time. And we hope to have more supply to provide to our community. Thank you so much for joining us today. Continue to stay strong and vigilant with prevention practices. And thank you for your engagement.